So my name is Ella of Finger Pharma, a Filipino-owned national company which specializes in anesthesia, critical care, and anti-infective products. So I'm here to introduce to you a new path in our assay management that is less toxic and more convenient to use, our Imtec teicoplanin. Imtec teicoplanin vial contains a 400 mg lyophilized powder for infusion, which is equivalent to not less than 5 ml ampule of sterilized water for injection. It is given intravenously or intramuscularly or both in bolus or IV infusion. So according to Center for Disease Control and Prevention, antibiotic resistance continues to be a serious public health threat worldwide. So as early as 1945, in the Nobel Prize acceptance speech of Alexander Fleming, who discovered the first antibiotic, which is penicillin, he said that then there is a danger for an ignorant man that he may easily underdose himself by exposing his microbes to non-lethal quantities of the drug that make them resistant. So he was able to anticipate the serious problem that the world is facing regarding antibiotic resistance. And to give you more background, antibiotic resistance is the ability of the bacteria and other microorganisms to resist the effects of the antibiotics to which they were once sensitive, while multi-drug resistant organism is defined as the bacteria that have become resistant to more than one class of antimicrobial agents. And a common example of this is the methicillin-resistant Staphylococcus aureus, or MRSA, which became evident in 1960. So it is the kind of MDRO that causes serious infections to different parts of the body, and it is tougher to treat than most strains of Staphylococcus aureus because it is resistant to most commonly used antibiotics such as penicillins, amoxicillins, cephalosporins, and etc. But great news, because for the first time here in the Philippines, there is now a better alternative in surgical prophylaxis, our Imtec teicoplanin. So what is Imtec teicoplanin? It is an antibiotic used in the prophylaxis and treatment of potentially serious infections caused by gram-positive bacteria, as well as infections which cannot be treated by other antimicrobial drugs such as methicillins and cephalosporins. It is indicated in adults and children with complicated skin and soft tissue infections, hospital-acquired pneumonia, community-acquired pneumonia, bone and joint infections, infective endocarditis, peritonitis with continuous ambulatory peritoneal dialysis or CAPD, and bacteremia. It is also indicated as an alternative treatment for Clostridium difficile infection associated in diarrhea and colitis. So the mechanism of action of Imtec teicoplanin is it inhibits the growth of susceptible organisms by interfering the cell wall biosynthesis at a site different from that affected by beta-lactams. Peptidoglycan synthesis is blocked by specific binding to dealanyl D-alanine residues. And in many cases, especially in infections acquired inside the hospital, usual antibiotics are ineffective and more aggressive drugs are needed. So teicoplanin and vancomycin, they are both effective. However, there is a concern that vancomycin may be more toxic, especially for the kidneys. So, according to the study of Svetesky et al., comparative efficacy and safety of vancomycin and teicoplanin, systematic review, there is no significant difference at all-cause mortality with regards to clinical failure, microbiological failure, and other secondary efficacy outcomes. However, there were fewer total adverse events requiring the discontinuation of the treatment, nephrotoxicity, and Redman syndrome. Actually, nephrotoxicity was much less frequent with teicoplanin in purified and unpurified vancomycin. And in regards to teicoplanin, there were no cases of Redman syndrome. And Redman syndrome is an anaphylactoid reaction caused by rapid infusion of antibiotic or glycopeptide. So again, in addition to that, since Imtec teicoplanin is lipophilic or hydrophilic rather, but significantly more lipophilic than vancomycin, therefore, it has a good cellular tissue distribution or penetration with prolonged half-life so that Imtec teicoplanin can penetrate into the tissues rapidly and slowly released back into the bloodstream. As teicoplanin is more lipophilic than vancomycin, therefore, it has has a better distribution profile. So teicoplanin does not penetrate into the tissues or into the erythrocytes or cerebrospinal fluid, but it shows good penetration into the lungs, bones, and soft tissues. So further, as Imtec teicoplanin has been widely used since its launch in early 1990s across various gram-positive infections in adults and children, and it is recommended by experts and global healthcare guidelines in various indications. And actually, one of that is according to the 2017 Surgical Infection Society, or SIS revised guidelines in the management of intra-abdominal infection. Teicoplanin is recommended as an alternative treatment for intra-abdominal infection or hospital-acquired intra-abdominal infections in patients considered at risk with enterococcus species and patients known to be colonized with MRSA. Second is according to 2016 WHO antibiotic use for sepsis and neonates, Imtec teicoplanin is recommended as an alternative treatment for community-acquired and hospital-acquired infection with gram-positive etiology in children 1 month to 18 years old. So for the dosage and administration, Imtec teicoplanin is very easy to administer. Same with other antibiotics. So the reconstituted Imtec teicoplanin can be given IM or IV. So the intravenous injection can be given as a bolus or a 30-minute infusion. But reminder that only the infusion method must be used in neonates. So for elderly or adults and elderly patients with normal renal function and moderate infections such as skin and soft tissue infections, urinary tract infection, and lower respiratory tract infection, the recommended dose is 6 mg per kilogram IM or IV, and the maintenance dose, the recommended dose is 6 mg per kilogram IM or IV administered for 3 administrations, and the maintenance dose is 6 mg per kilogram IM or IV once a day. And for moderate infections such as skin and soft tissue infections, septicemia, endocarditis, the recommended dose is 12 mg per kilogram IM or IV, and administered for 12 administrations for 3 to 5 administrations, and the maintenance dose is also 12 mg per kilogram IM or IV as once a day. And for severe infections, the recommended dose is 10 mg per kilogram IM or IV. So in patients or in adults and children with renal insufficiency, the reduction of teicoplanin treatment is not required until the 4th day of teicoplanin treatment. So again, everyone, to summarize, Doctor, what I have discussed, Imtec teicoplanin is a better alternative over vancomycin because of its lower nephrotoxicity. It has no Redman syndrome. It has synergistic combination with aminoglycosides, cost efficient and cost effective because it is only once a day, and it is convenient dosing and administration because it is only once a day. And lastly, the catalog price of this is just 1,950. So again, Doctor, Imtec teicoplanin is first here in the Philippines, and it was passed the bioassay and carefully evaluated by CIDRIS. It is also exclusively distributed by Philcare Pharma, and it passed the bioassay as CIDRIS, and it is manufactured by SRS Pharmaceuticals, who is also a WHO and GMP certified. So again, everyone, I hope that you will consider our Imtec teicoplanin as an alternative treatment for MRSA management to at least 3 to 5 of your patients. So again, Doctor, thank you very much for your time and allowing me to speak in front of you. Again, my name is Ella of Philcare Pharma.